Do we have a quorum? We
We
have
do.
19 members.
Oh, we do?
I think so.
Okay.
5, 6, 7, 8, 9, 10, 11. We have 19, so for a quorum we would need 10, right? Or 11.
Right.
It's just a simple majority.
Yeah. Very good. How about yourself? Very nice. How about yours?
Kept me busy. Baseball and
Sports?
soccer
Yeah. It's
and basketball.
fairly good weather. Well, we have what, 11, 12. Okay, here comes Bob Freeman. That's 13. That's okay. That's good enough. Um, Good morning. The Insurance Committee of the Tennessee House of Representatives of the 113th General Assembly is now in session. Today is Tuesday, February 21. The time is 10:35. Mr. Clerk, please call the roll.
Representatives Capley, Sapicki, Davis, Freeman, Haynes, Hemmer, Hicks, Johnson and Montgomery, Johnson and Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin, Chairman Kumar.
Here.
Mr. Chairman, you have a quorum.
Thank you. Among personal orders, members, it's my privilege to welcome members of the Tennessee Hospital Association who are here today. They are heroes who take care of us during tough times, including the COVID pandemic. Members of the THA that are visiting here, kindly stand so we can acknowledge you. Thank you for coming, and thank you for all that you do for our society. Members, any other orders, personal orders? Representative Freeman, you're recognized.
Thank you, Chairman. I would like to thank all those in the audience today wearing purple in support of our trans youth and adults of the state. Thank you.
Thank you. Any other personal orders? Seeing none, we will move on to our calendar today. We have 5 bills on the agenda or our calendar. Item number 1 is House Bill 1215 by Chairman Rudd. Do I have a motion? We have a motion and a second. Chairman Rudd, you're recognized.
Good morning, and thank you, Chairman and members. I am here to present to you HB 1215 on behalf of Speaker Sexton, and we do have an amendment. I believe it's code 3881 that makes the bill.
It will be good to place the amendment on the bill, then Chairman Rudd can explain to us the whole matter. We have a motion and second. All those in favor of adopting Amendment 003881, please say aye. Opposed? Amendment goes on the bill. Chairman Rudd, kindly explain to us about the bill and the amendment.
Thank you. This legislation is by Speaker Sexton. It is the Managed Care Organization MCO Reform Bill. Barring any law to the contrary, MCOs that contract with TennCare for medical assistance shall not provide reimbursement or coverage for a medical procedure is for the purpose of artificially changing a person's sex. TennCare shall not contract with any MCO to provide medical assistance if the MCO provides reimbursement or coverage of medical procedures prohibited under Section A through. The contract with the following: the contract with the Bureau of TennCare, a private health care insurance regulated by the state or local insurance program in this state or another state, or any other program for insurance medical assistance regulated or administered by another state. Again, these are for the MCOs with TennCare. The amendment clarifies, after questions last week, the amendment clarifies that MCO's coverage or reimbursement includes coverage or reimbursement by an entity using the same or similar name or trademark to provide healthcare coverage via license or other means, regardless of whether the entity is an independently owned entity from MCO contracting with TennCare or operating in a designated service area other than this state. Two, the entity that is a member of the license of the same parent association, federation, or as an MCO contracting with TennCare, regardless of whether the entity is operating in a designated service area or in another state. The entity, number three, the entity that is a subsidiary of the same parent company as the MCO contracting with TennCare, regardless of whether the entity is operating in the designated service area or another state. It further clarifies that a violation of the contract, that within the 30 days of the effective date, the provider must come into compliance. B, the MCO is a violation of this contract with TennCare to provide medical assistance pursuant to this part of the effective date of this act shall come into compliance no later than 120 days from the effective date of the act. The Department of Commerce and Insurance of Tennessee is authorized to periodically review each MCO pursuant to its authority under Title 56, Chapter 2, Part 9 to ensure compliance with this section. If the Department of Commerce of Insurance of Tennessee finds that the MCO is operating in violation of the section, the DCI shall provide notice to the MCO and TennCare of the violation. And finally, TennCare shall immediately provide notice to the finding of the MCO. If the MCO fails to remedy the violation within 90 days after receiving the notice, then the MCO may contest, which is new to this may contest the finding and request a contested case hearing in accordance with the Uniform Administrative Procedures Act. And again, this bill does not, I repeat, does not discourage or prohibit counseling.
Thank you, Chairman Wright, for a complete explanation. Members, do we have questions? Representative Freeman, you recognized.
Thank you, Mr. Chairman. I wasn't in the subcommittee, so I didn't get a chance to hear the reason. But traditionally, when we work on bills in the General Assembly, it's to help the citizens of our state and to make sure that we make things work better. Tell me what we're solving for with this. What is the problem that we're trying to fix?
Chairman Wright.
We're not particularly trying to fix a problem. This is just a service that is currently available to TennCare that will no longer be available as other services under TennCare are not provided. TennCare provides certain services, and one of the main reasons is this type of service and the way it is being starting to be implemented is not within the values of most Tennesseans. But the main reason is this simply is not a service that's going to be provided by TennCare.
Representative Freeman.
So I heard you say the values of most Tennesseans. We're forcing people to have these procedures, or is that I didn't follow what you meant there?
Chairman
These
Wright.
are medically unnecessary procedures to do surgery to remove body parts or change a person's perceived sex through artificial means. And this is not a medically necessary procedure. And we will still provide counseling, but not the actual medical procedure.
Representative Freeman.
So what provisions are here that would protect for those born with both genitalia? How would we handle that? Would they not be able to receive treatment under your bill?
That is not covered under transgender. That's separate.
So you would interpret that that would not affect those treatments?
No.
Okay. Well, there are a couple of days a year that I feel the need to apologize to members of the state, and this is one of them. I'm sorry that this is happening. Thank you.
Representative Johnson, you recognize.
Thank you, Mr. Chair. So we're talking about procedures that are backed by all of the main medical organizations. We're also talking about, you're saying that some Tennesseans don't agree with this procedure. Well, physicians and families do. There are a lot of Tennesseans, the vast majority of Tennesseans don't believe that we're using public tax dollars for vouchers for private schools, but we're doing it anyway. So there are a lot of things. A lot of Tennesseans don't agree with crisis pregnancy centers, but we're sending them $100 million. So you're telling me that we can pass legislation solely backed on the fact that some people disagree, even though the medical community says this is a procedure that has merit and works and is what is needed by part of our community.
Chairman Wright.
I'm sure you can pick any subject, whether it be medical or any other ideological subject, and you can find somebody that's going to support it and somebody that's going to oppose it. There's been very, very few medical professionals that have come to me that have supportive of this. And again, it's not a matter of whether you view it as proper or not. It's just this legislation would simply say it's not available under TennCare, under Tennessee tax dollars. They can go elsewhere and they can have private insurance or pay for it themselves. We're not preventing that as long as there's other legislation to deal with youth. This one doesn't cover that, but that would be up to the individual.
I would, if I may, I would like to add sincerely that the fact that a number of the medical organizations do support these procedures, that really does not necessarily mean that they are medically indicated. It really depends on their political persuasion. I would like to sincerely note that, and I think we discussed it in the previous hearings. Representative Johnson, you recognize.
Thank you, Mr. Chair. I was not in those previous hearings, but I just am very much aware of some of these major organizations that do support this treatment. And I'm also aware, are you aware of any states that have passed this similar law?
Chairman Wright.
To my knowledge, there are 3 states that have something similar to this, but not like this. You've got Florida and Georgia and Arkansas. Arkansas is about malpractice. It's not anything related to this. Florida's is also different, and even Georgia's was different, where the way theirs was worded, and theirs was settled out of court, and it was about youth. It was not about all people, and it was not about state coverage. It was about specific youth, and the way their legislation was worded, it was discriminatory. This is not.
Well, it's interesting that, initially we heard that this was a thing to protect youth, but now we're seeing that it's really about all transgender people. And what we know is economically, they tend to suffer due to their socioeconomic status. They're more likely to be homeless, have food insecurity, be discriminated against in employment. And so therefore, everyone's not able to get the care that they need with their own money. And what we're doing is creating a have and have not society. And what we're hearing in these other states, this is absolutely illegal and has been turned over in some respects. In multiple states, we've got Georgia and West Virginia. I think here it's in the courts in Florida, and it's not faring well as it goes. So I'm just concerned that we are doing something here to a certain segment of our society and targeting them when what we should be doing is lifting up every Tennessean and making sure that they have the privacy of the health care that they need in concert with their doctors and their families. This is just, it's reprehensible to me that this is what is coming before us. And every time we hear something similar, when it comes to a particular community, it's all targeting them and negative and taking away care and taking away services. And I just hope this is not what Tennessee has become.
Chairman Wright,
No, that's
thank you.
her personal belief. I'm not going to debate it here.
Representative Mitchell, you recognize.
Yeah, thanks, Mr. Chairman. So let's get your amendment straight. So just tell me anything I say is wrong or if your amendment is corrected. So the MCO, they can't provide these services to anyone in TennCare, correct?
That
Chairman
was
Wright,
already part of the original bill, but yes, that's
Yeah.
still in effect.
So can the MCO provide these services in the state to people outside of TennCare?
No, not have the contract with the state, no.
Can the MCO provide services in another state?
Not that particular MCO, no.
Okay. That's enough said. Your values are great as long as they do not conflict with the United States Constitution. And as we talked about in the subcommittee, it's not worth my time sitting here arguing. You're going to pass it through this committee. You're going to pass it on the floor. And the first minute it sees the courthouse doors, this bill is getting ripped up. So with that being said, it's no sense in even arguing over silliness.
Representative, I would like to defend Chairman Rudd's commitment and respect for Constitution. I know him personally. Representative Hammer, you're recognized. I'll come back.
Thank you, Mr. Chairman. I was concerned from looking at the fiscal note that it felt like it wasn't accurately affecting the true impact to the nature of this bill. So I requested TennCare to actually get their information that their actuaries and staff submitted to fiscal review for this bill. One of the things it said, and my suspicions were confirmed, it said that actually the total state dollar impact of the above analysis is $210 million of recurring state cost. That was not in the fiscal note, so I want the members of the committee to know that. Additionally, it said that TennCare would likely see significant administrative impacts. It would require them to switch to fee-for-service likely, and that comes with additional audit risk, which would have significantly higher payment error rates. So I was just curious, are you concerned with the increase in cost and the lowering of quality that would come with this bill?
Chairman Wright.
Well, I know you have you want the bill to say certain things and do certain things, and if you're for or against the bill, that's fine, but that's not what's in the fiscal note, and that's not what fiscal review has come up with, and not what TennCare has reported to me. And, we're dropping a service, so I don't see how it would be a significant increase. Now, if for some reason TennCare has to take up and hire more additional staff and take up part of this down the road, if what you say happens, then we're not paying the insurance company or a particular insurance company, and they take on part of the responsibility themselves if that should happen. I don't see that happening. We've had so many insurance companies that are wanting to be one of the three MCOs. I don't see why that there won't, if any of these three do not want to cover this, why that we couldn't find someone else.
Thank you for that. My concern is, and what I've heard from the industry as well as others, is there's not going to be an MCO that checks those boxes due to the different federal regulations, ERISA laws, everything else. So that my concern is we be upending the apple cart, so to speak, with this bill. Thank you.
Chairman Wright.
Thank you. I think the bill speaks for itself. The speaker and his team have crafted it very well. The legals crafted it very well. The contents of this bill, the way it's structured, has not been challenged before in a court. All the other bills were different, and they were challenged under different grounds. And this amendment clarifies and gives a lot more definition to the bill. And I think that will be on sound legal ground.
Well, thank you. Chairman Speaker, you're recognized.
Thank you. Thank you, Mr. Chairman. Quick question. I'm scanning your amendment and I don't see any restrictions on mental health care. Was that omitted, or people can still get mental health care for these issues? Is that correct?
Chairman Wright.
That is correct.
Okay. And some of my colleagues have made comments that aren't necessarily the truth. It's a version of a truth, but it's not the truth. Currently, if this bill would pass right now, members, there are 6 insurance companies right now that can comply with this legislation. Right now, 6 of them. If we go to an application state in Tennessee, instead of letting TennCare dictate who's going to be our MCOs, then we could have 6 additional insurance companies that could step up right now, because even if this bill passes, the numbers that are on TennCare are not changing. So when these companies come online with new MCOs, they will assume and take over the people that are on TennCare right now to provide health care. And if you would have 6 MCOs come in, then you could bring competition into the marketplace, which might help us in rural healthcare, allowing our rural hospitals to stay open, and also provide more pay to our providers to allow better healthcare and better opportunities that way. So, like I said, Mr. Chairman, I hear some things that are being said in this committee that are not necessarily accurate. I just want to put some accuracy into this, Mr. Chairman.
Thank you, Chairman Speaker.
Thank you for clarifying that. Like I said, there are providers that can take up the slack if any of the current 3 do not want to renew. If they don't want to change there are other services outside of TennCare. There are others that can take up those contracts.
Representative Mitchell, did you still want to say something about it? Right.
Mr. Chairman, my concern was just equal protection of the law for all citizens of this state, which we obviously know that's violating. And being in such a pro-business state, I thought we may be interested in the commerce clause a little bit in this committee as well. Thanks.
Well, thank you. Any other questions? Seeing none, are we ready to vote on House Bill 1215? All those in favor, please say aye.
Aye.
Opposed? No. The ayes have it. The bill moves on to Finance Committee. Those voting no, if they want to be recorded no, please let the clerk know about it. Our next item is House Bill 152 by Chair Lady Hazelwood. We have a motion and a second. Chair Lady Hazelwood, welcome, and you're recognized.
Thank you, Mr. Chairman. And I just would like to add my thanks to the words mentioned earlier about the work of the hospitals that I'm here on behalf of today. I mean, they have done yeoman's work throughout the pandemic, and they and the staff, the whole medical community, we owe a great deal of gratitude to. But I'm here on House Bill 152. It does have an amendment, Mr. Chairman, that makes the bill. That amendment number is 3793.
Yes, that's what we have. We have a motion and a second on the amendment. Let us attach the amendment. Are we ready to vote on Amendment 3793? All those in favor, please say aye. Aye. Opposed? The amendment goes on the bill. Kindly explain the amended bill to us.
Thank you again, Mr. Chairman. And this is the Tennessee Hospital Assessment Bill. It comes before you every year, and it continues that to fund a major part of the TennCare program. This amendment, or this bill, this legislation was first passed in 2010, and this bill this year will result in more than $691 million in state funds from the hospital assessment, which are then eligible for federal match to bring down money to support the TennCare program. With the matching dollars, this represents $1.8 billion for TennCare and for our medical costs for the state, for our citizens who are participating in the TennCare program. This year, the bill continues to assess at the rate of 4.87, which is not a change. And it generates the state matching dollars that I mentioned earlier that will be used to draw down the federal funds. We did this year change the assessment data rate from 2019 Medicare cost report to we changed to the 2019 Medicare cost report. Previously, it was based on the 2016 Medicare cost report. And I think all of us know that costs for healthcare services have not gone any direction but up, just like every other service and salary that we talk about in our committees and yours every day. The change is necessary to just realign the revenue with the cost, and so that we can continue to provide the current services that go to TennCare population. Over the past 12 years, I think it's worth noting that the annual amount of funding for the items that the Tennessee Hospital Association continues to cover has increased by $294 million, and hospitals have funded a total of $139 million in growth. And all money that's collected, I think this, again, the hospitals have made it clear, the legislation makes it clear, there will be no pass-through of these charges to the end user customer. All of these monies will go into a fund, and that fund will be used to support TennCare and to make sure that we're not cutting any services that are currently provided and services that would not be able to be provided without this assessment. So with that, Mr. Chairman, I would just stand ready for any questions.
Thank you. I agree. Certainly, it represents a significant source of funding for healthcare in our state. Members, do we have questions? Seeing none, we are voting on House Bill 152 to go to Finance Subcommittee. All those in favor, please say aye. Opposed? The ayes prevail. The bill moves on to Finance Committee. Thank you.
Thank you.
Our next item, number 3, is House Bill 314 by Representative Vital. Representative Vital, we have a motion and a second. Kindly, do we have an amendment? Drafting code 3567.
That is correct.
We have a motion and second on the amendment. Let us attach it, and then you can tell us about the amended bill. All those in favor of adopting Amendment 3567, please say aye. Opposed? Amendment goes on the bill. Representative Vital, you're recognized on the amended bill.
Thank you, Mr. Chairman. Thank you, members of the committee. I am here carrying House Bill 314 on behalf of the Department of Commerce and Insurance. The current provision was intended to provide protection to consumers from surprise billing by out-of-network providers for services offered at network facilities. With the passage of the Federal No Surprises Act of 2020 and its application to providers and insurance carriers in Tennessee, providers are now federally prohibited from billing patients in network facilities. There are also references to the existing notification requirements in Title 56 and 68. The bill removes the notification requirements also of those two titles. With that, Mr. Chairman, I am available for any questions.
Members, we've discussed the No Surprise Act and the federal law, and that has been really good in the sense of protecting the patients. Do we have any questions for Representative Vital? Seeing none, we are ready to vote on House Bill 314. All those in favor, please say aye. Opposed? The ayes prevail. The bill moves on to Calendar and Rules Committee. Thank you for bringing this.
Thank you, Mr. Chairman. Thank you, members.
Item number 4 on agenda is House Bill 893 by Chairman Reedy. We have a motion and a second. Chairman Reedy, you're recognized.
Thank you, Mr. Chairman and committee. House Bill 893 extends the Ground Ambulance Service Annual Assessment to June 30th of 2024. Mr. Chairman.
Members, do we have any questions? This is the yearly assessment bill that we do, and again, a significant source of funding. Questions been called. All those in favor of House Bill 314, please say aye. I amend myself. It's House Bill 893. Let us do it again correctly. All those in favor of House Bill 893, please say aye. Opposed? The ayes prevail. The bill goes on to Finance Subcommittee. Thank you. The last item on our agenda is House Bill 371. Representative Darby, we have a motion and a second. You're recognized
Thank you,
on
Mr.
House
Chairman.
Bill 371.
Thank you, Mr. Chairman and committee. House Bill 371 was brought to me by the Tennessee Disability Coalition and seeks to amend the ABLE Act. In 2015, the General Assembly passed the ABLE Act, which gives people with disabilities the opportunity to save and invest in a tax-free savings account that helps them maintain independence and improve quality of life. This bill gets the estate recovery claim in line with what CMS currently requires, that only allows for TennCare to do an estate recovery claim for those who pass away that are 55 and older, and the Treasury's Office and TennCare are both okay with this bill.
Members, you've heard the explanation. Do we have any questions? Questions been called. All those in favor of House Bill 371, please say aye. Opposed? The ayes prevail. The bill moves on to calendar and rules. Thank you.
Thank you, Mr. Chairman and committee.
Members, do we have any parting thoughts? Seeing none, do we have a motion to adjourn? Without objection, we stand adjourned.